Assalamu alaikum, I'm Dr. Abdulaziz Yusuf. Welcome to today's lecture on our hospital policies and procedures for external transfer or referral. Today we will discuss the referring emergency cases between health care levels. Question number 1. A patient arrives at a hospital with a condition that requires an urgent and specialized surgical procedure not available at the facility. The treating doctor decides that the patient needs to be transferred to another hospital for this surgery. What is the classification of this case type? A. Standard medical case. B. Non-urgent referral case. C. Emergency case. D. Life-threatening case. The correct answer is C. An emergency case involves situations where a patient requires urgent medical intervention or a procedure not available at the current hospital but is available at another hospital. In this scenario, the patient's need for urgent surgical procedure that is not available at the present hospital categorizes it as an emergency case. Question number 2. A doctor has decided to transfer a patient to another hospital for emergency treatment. What is the first step the doctor should take? A. Contact the receiving hospital directly. B. Prepare and submit medical report to hospital's medical referral coordinator department. C. Arrange for patient transport. D. Discharge the patient from the current hospital. The correct answer is B. When a treating doctor decides to transfer an emergency case, their first step is to prepare a medical report for the case, stating the reason for transfer. This report is then submitted to the hospital's medical referrals coordination department. The preparation and submission of detailed medical report are essential for effective coordination and to ensure the receiving hospital is fully informed about the case. Question number 3. After receiving a medical report for an emergency case transfer, what is the initial action that should be taken by the medical referral coordinator department at the referring hospital? A. Inform the medical referrals coordination operations. B. Arrange emergency transport for the patient. C. Directly contact the receiving hospital. D. Verify the documents' accuracy and completeness. The correct answer is D. So the initial action by the medical referrals coordination department at the referring hospital upon receiving the medical report is to verify the accuracy and the completeness of the documents. This verification is crucial for ensuring that all necessary information is correctly provided and formatted, like the scan in format 54M. This facilitates a smooth and efficient transfer process to the receiving hospital. Question number 4. Once an emergency case transfer request is received at the hospital, what is the first step should be taken by the medical referrals coordination department at the receiving hospital? A. Print the request and deliver it to the required specialty. B. Arrange for immediate medical evaluation of the patient. C. Notify the medical referrals coordination department of the patient's arrival. D. Directly contact the referring hospital for additional details. The correct answer is A. The first step for the medical referrals coordination department at the receiving hospital upon receiving a transfer request is to print the request and deliver it to the required specialty. This action is vital for initiating the internal process of response and ensuring that the appropriate medical team is informed and prepared to make the timely decision on the case, as well as to provide a response within a maximum of 3 hours. And this step is for the subsequent action related to accepting, refusing, or managing the incoming emergency cases. Thank you for joining us. Stay tuned for more policy reviews.